Many people ask us what can we do if they've got a tooth that's breaking down or a tooth that's lost. One of the things we find in dentistry, the more heavily filled teeth become, the weaker they become, and the biggest risk is fracturing those teeth, and the ultimate sin would be to lose the tooth altogether. One of the things we recommend in dentistry is to strengthen those teeth up when a tooth becomes 60% filled or above. And let's talk about that, and I'll show you why using a photo. So what happens is when we have a tooth, and we've got this very heavily filled tooth with large filling in it, the wider that filling becomes, the weaker these outside parts of the teeth are, and the tooth starts to flex. When we have our opposing tooth sitting here like this part of the tooth hits the filling and wears it down more and more and more over time, so more and more pressure gets placed upon this part of the tooth. And as this part of the tooth flexes back and forth and we're chewing our food so we can pulverize that food, even more pressure gets put on here and this part of the tooth starts to flex back and forth. And as it flexes back and forth over time, we get these little tiny cracks that propagate through here until one day off falls the outside of the tooth, corner of the tooth. Or worse still, the crack can come down towards the middle of the tooth and where the nerve is, and it either kills the nerve, or worse still again, we split the tooth in half, we end up losing the tooth altogether. So what can we do if the tooth becomes heavily filled? Well, one of those options, and one very traditional option in dentistry, is putting a crown on the tooth. What we do is we trim back about 1.5 millimeters off all the way around the outside of the tooth and put a cap or a crown around the outside of the tooth to help strengthen it up. And the good news is that by holding that tooth together, we give that tooth more resistance to be able to break on us. It's stronger, it wears well, and it certainly keeps the tooth in the mouth for a lot longer. One of the newest ways of doing things, or a different way of doing things, is being a lot more conservative. And once again, if this is our tooth, we have a large filling in the tooth, and even if that filling was spilling over to the outside part of the tooth, what we do with this particular idea is we take out the rest of the filling, we have a look at the tooth that's left. If this is very thin across here, we cap it across there and we make this porcelain bit to glue back inside the tooth. And this is called a porcelain bonded restoration, or a PBR, or an onlay is what the old term would be. The biggest advantage of this is that it's far more conservative. So we don't waste a lot of tooth structure. We don't actually amputate all this really good tooth structure around here like we used to with the crown. So they're basically the two biggest options for filling really heavily filled teeth. We can also go, if we have to replace teeth, there's another way of doing it. If we have our two teeth either side, and we're missing a tooth that's in between in here, what we can actually do is put an implant in. And an implant is a titanium screw that gets put down into the jawbone. And it allows the bone to then heal around that. And then we can actually make a tooth that's screwed into place in their little stony screw in the bed to make it look and behave like your own tooth. It's very strong. It's got a good 20+ years survival rate provided you look after it. So that's one way of replacing teeth. And this is more of the modern dentistry we're doing these days.